I've been training in Paris, so that's particular because in Paris you've got many centers. 11 CHU, because that's university hospital, let's say. There is a main difference between Paris and the other part of France. That means that there is 11 hospitals. So you've seen orthopedic difference run by different professors with different techniques. Prices, for example, is probably twice the price in India. The global cost for social security and even extra fees. Double, maybe triple, but not 10 times more. The United States is 10 times more expensive than France.
Welcome to Brew with Bones podcast. Today, our guest is Dr. Jean-Noël Martin. As we say in our English, but in French, you will say Jean-Noël Martin. He's a renowned upper limb surgeon in a place called Rouen in north of Paris, north of France. He's been practicing for almost a decade in upper limb surgery. So we'll be asking him a lot of questions, and we'll try to get to understand him and the way orthopaedics works in France. Thank you for coming to the podcast.
Thank you.
Sir, Dr. Jean-Noël, can you walk us through your journey?
Well, you have to orthopedic surgeon. You have to go to medical school like in India. It takes 5 years. Then to go to residency, five more years. A little bit like in India, I guess. And after you go to postgraduate during 2 to 4 years, basically. I wanted to be a hand surgeon when I was 11 years old. So by chance, I'm doing some hand surgery, but now I've been trained in Paris to all the orthopedics surgery, from spine to hand to a lot of hips and knees trauma, like you do also. And finally, and at last and at least, upper limb surgery, including hand, but I'm doing a lot of shoulders, mainly shoulders and hand surgery, and some elbow, obviously, but it's less common. I'm only doing elective surgery, mainly. Some trauma, but it's very rare.
So, Dr. Martin, how did you choose shoulder, elbow, and hand as a specialty? What made you choose them?
No, first I wanted to when I told you a child, I wanted to do hand surgery, but after my residency, I've been trained, and even after my postgraduate, I've been trained to everything in orthopedic surgery, from children, spine, everything. And it was quite by odd, because my wife was sent to another town, which is not Paris, but Rouen, where we do live now. And in the clinic, I found a place. They were looking for only upper limb surgeon. So I said, okay, I'm trying to do everything. So I'm going to over-specialize. And that's been 20 years now, not 1 decade, 2 decades I'm here. I'm very happy doing the upper limb surgery.
Excellent. So you had an interest in upper limb and you had a demand as well.
Exactly.
So how is shoulder elbow surgery structured in France? Is there a central exam or a match process like in the US for getting into shoulder fellowships?
Well, you have to pass some exams to become a doctor just before residency. Then at the end of the residency, you have an exam. You have to write articles and pass an exam, and basically that's it. You have to take basically I've done, for example, arthroscopic, we call that inter-university exam. Certification. That exam you take in few universities, and that's a good one. So it's an exam about arthroscopy. There are some exam and possibility degrees for hip, knees, upper limb also. But everybody can, with license for, let's say, orthopedic surgery, can do everything. You don't have to have a specific shoulder, for example, degree.
Okay. So how do you get into fellowships? Is there a central process, or you just have to apply to the mentor and have a good CV? They will choose you. How does this happen?
Well, I've been training in Paris, so that's particular because in Paris you've got many centers. 11 CHU, because that's university hospital, let's say. And at the end, you become a postgraduate in one or two hospitals, and I had a very good mentor, probably one of the best surgeons ever, which was Professor Judet, Gudet, long family of orthopedic surgeons back to the 40s. And so I've done my fellowship with him. I mean, part of the residency and also the fellowship, the postgraduate. And after, I have to over-specialize. So I went to different places, friends of my mentor, for example, Gilles Valch, which is one of the greatest elbow shoulder surgeon ever also, in Lyon. And I just over-specialized. I've done some observationship in few centers, like I've met Professor Dr. Valch. I've been to Dr. Lafosse, which is very famous in orthopedic surgery, I mean in shoulder arthroscopy. I went to Stephen Burkhardt in San Antonio in California, and Dr. Olivier Courage in Le Havre, which is close to here. And basically that was it. And after I trained by myself, because, and you know, it was back in year 2005. So it was quite the beginning of the, how to say that, the shoulder improvement, you know. And after that, I have a high volume of activity. So I trained by myself mainly.
You've been with all the legends in shoulder surgery.
Yeah, sure. Burkhardt, Lafosse, exactly. Yeah.
Hi, Dr. Martin. This is Dr. Satish Muthu from the members of the Brew with Bones. So my question for you is
Hello,
that,
hi.
Like, what's the major difference you find in the like the training between the France and the other countries, like the European ones and the France? Is there any particular difference between them, or is it same across the Europe?
There is a main difference between Paris and the other part of France. That means that there is 11 hospitals. So you've seen orthopedic difference run by different professors with different techniques. So that's interesting because for example, I've been trained in hip surgery for by doing the THA through all the approach possible. I had a real training in anterior approach, posterior approch, trochanterotomy, lateral approach. That's an example. For shoulder, I've been trained later for beach chair or lateral. You know, for let's say for reverse, I've been trained to do the reverse through the deltopectoral approach and the superolateral approach. So that helps you to choose at the end what you prefer, because you have been trained for all the other techniques. In trauma, for example, some centers were only focused on plating and others on nailing, some on pinning with some wires. So I think more than France, because I don't know exactly how it's trained, people are trained in another place in the world, but Paris is different because you're trained different techniques. You'll be exposed to very different techniques, and so you can choose because you have been trained. You know, it's not like lectures. You've been trained really. But that's 20 years ago. Nowadays, I don't know how it works exactly.
Going back to what you said, you worked with big names like Professor Jude. How was your experience at the time? Like, how was he as a person to you when you were a student? Because like we don't have such legends as of now to see. So how was it working with people like that?
Well, so he wasn't doing much arthroscopy, neither hand surgery, and not so much shoulder at this time. So I've been training for like, it was not basic surgery, but all the basis of my thinking come from him, and my hands training also. He's still alive, but he retired. Well, I think he put his first THA when he was 13 years old. That's what the legend or the myth is, because his father was one of the greatest orthopedic surgeons ever. Back for 1947, and then he gets retired in 1981, and my mentor came after. It was a guy. He's a guy. I don't know if I can say that recently. He's a master with it. He's a very hand skilled person, and he loves to transmit his knowledge. But that's not knowledge by lectures, or it was knowledge by the hand. He was helping you taking your osteotome and your hammer. Say you have to use it this way, and not, you know, every instrument at this place. Very precise procedures, and what makes him special, it was he was able to do, for example, hips revision, shoulders also, but mainly elbow surgery, arthrolysis. He described it. He invented one of the best radial head prostheses. He was in ankle surgery. He can do everything, even very difficult cases like non-unions for every bone possible, malunions, non-unions, septic non-unions, and also backfoot ankle surgery. You were able to build a Elizarov frame for progressive correction of deformities in a unique way. I don't think, still in France, I guess, somebody is able to do all these things.
That is something it's been said to us a lot. Like people from the past, the surgeons or physicians used to be masters of everything. But as of now, we tend to focus on small scope of things and
That's it.
do it
That's
well.
it. So it's easier to be
Yeah.
to be good at one like shoulder surgery.
Yes.
It's easier on you know, only elbow, only wrist. It's easier, but it's good to know what is possible to do for everything in orthopedic surgery.
Yeah. Coming back,
So
how is the healthcare system structured in France for orthopedic surgeons? Do you have anything to say for us about that?
Well, that's one of well, France is very different from the US of India. Mainly, everybody's got a social security. I mean, not mainly, everybody is covered. So everybody can have the best healthcare possibilities. That's 100%. So if you go to a hospital, nobody has to pay nothing. I mean, and if they go to private, they have to pay some extra fees that the surgeon ask as they wish. So you can be an expensive surgeon or a cheap surgeon, even in private. And all the extra fees are covered mainly, almost completely, by private insurances. And the Social Security is covering, is paying for every implant, every. That means I can put for free for the patient 8 anchors in the shoulder if I want. Then it doesn't. It's not a problem. So that's very different from India. And the level of prices are so low compared to the United States, for example, that it's affordable for everybody, even the private. So we don't have really limitation in treating the patient. That's quite, I think, maybe unique in the world. Prices, for example, is about probably twice the price in India. The global cost for Social Security and even extra fees. Double, maybe triple, but not 10 times more. The United States is 10 times more expensive than France.
that's very unique, Dr. Martin. Yeah, it's cheap as well as 100% coverage.
Yeah, that's it. And we can have high technologic implants also. Not everything, but for example, we've lost one of the best elbow total shoulder, total elbow replacement, because it's not paid enough by the Social Security. So the American company who bought this nice implant is not selling it anymore in France. So it's not absolutely perfect, but it's very good still.
Okay. So you are currently practicing in a government setup or in a private setup or in both? How is your practice now?
I'm only working in the private setup, but it's 90% is covered by the social security. But it's not a real. In France, it's not a real completely private. You know, my patients are reimbursed by the private insurance, and 90% other costs have been covered by the Social Security. So they don't even know the price of the procedures at the end. So that's private, the French way. It's semi-private, we can say that. And I'm doing only elective surgery, but in private, one of the problems is that you don't have much possibilities to share your experience. That's why I'm very happy to have fellows coming from everywhere, but mainly from India, mainly. And that's a pleasure to share experience. Yeah. That I couldn't do could do in hospital if I was like a professor, which I'm not. I'm a private surgeon. So that's a pleasure to talk with you guys and to have Srojin Kem and many fellows. And I hope they're happy to have come here.
So we wanted to ask you if you are working in a public hospital or private or a hybrid model. So is it possible for a person to work both ways? Is it allowed in France?
Completely, yeah. It could be half or part-time hospital. That many surgeons and doctors are doing that. It's good, so you can share experience with young surgeons, residents, for example, when in the public. And if you have some emergencies to do and trauma, for example, we do less trauma in private than in public. But it depends on the opportunities you get in the hospital. If I were still working in Paris next to my mentor hospital, surely I will be half private with him and half public with him and my private. Private surgery in France is more efficient. You can do more. It's faster. You can do more patients a day. So that's an important point. If you want to treat as many possible patients as possible, and that public is good also. It depends on every department's got their own, I was trained in Paris. It would be easier for me to go in a hospital in Paris than in the one who nobody knew me, at least in the hospital, in the public. So
Okay, that is very interesting to know. It's quite similar to India. In India, too, the surgeons can work in both private and public setups in most of the institutions at the same time.
yeah.
So coming to your professional journey, we heard that you had a professional rugby career. How did that experience shape your perspective as a sports or a shoulder surgeon now?
It was semi-professional. Because of medical school, school is difficult. You have to work more and not practice more rugby. Well, basically, one thing I love very much with rugby is that's a team practice. You had difficult things to do because it's a contact game with like a team, and the people are very different in rugby. From a liner to winger, the physical abilities are completely different. Some people are 7 feet tall, and some are very small but very fast. And some are very, the team is all the players. You can't change a player to another one. It's not possible. So for me, team in the surgery, well, you got nurses, you got assistants, you got anesthesiologists, you got physiotherapists. So that's a team with very different people finally. So for me, it's quite natural to compare that, and probably my rugby history led me to be very pleased to work in the team. That's it. I can say that.
Okay. So given that rugby career as a background, do the athletes in your practice trust you more because of that? Does that have a role in your practice?
What? Yeah, I'm not a famous athlete. It's not known in the newspaper. Our second division will say that. But when we talk with the people, with the general, when I talk with sport doctors, we talk about sport and we talk about our backgrounds and and with the patient also, when they play rugby, I know what they are doing on the field, so we can share. So I think it's good for the trust, yeah. And then probably they will trust me well because of that, or a little bit of that. Yeah, yes.